Hey there, today's topic is the use of Tenofovir for the treatment of hepatitis B virus. So what is hepatitis? Hepatitis B is a virus that infects the liver. It is spread through the contact with bodily fluids of an infected person. Such contact may be due to sexual intercourse, sharing needles like when you're getting a tattoo or a piercing, sharing personal items such as razors with an infected person. Symptoms include things like jaundice, loss of appetite, fever, dark urine, pale-coloured feces, and nausea.
After HBV has entered a liver cell, genomic HBV DNA is transported to the nucleus, where it is converted into covalently closed circular DNA. This cccDNA functions as the template for the transcription of several viral messenger RNAs. These are exported to the cytoplasm and then either translated into viral proteins or packed into nucleocapsids and converted back into viral DNA. A newly formed virus is released from the cell.
In 2015, hepatitis B was the cause of approximately 887,000 deaths worldwide. To reduce the morbidity and mortality of this disease, there is a need for continued efforts to identify the best treatment option available. Thyroid is the trade name for tenofovir disoproxil fumarate, or TDF, a prodrug of tenofovir. In vivo, TDF is metabolized to tenofovir, a prescription medication commonly used alongside other HIV medications to treat chronic hepatitis B. Although it can't cure HBV, it is generally used for the treatment of disease by controlling the ability of the virus to multiply. Tenofovir can be administered orally through a crystalline powder or a tablet which contains 300 mg of TDF. Some side effects include things like nausea, diarrhea, and headaches. More serious effects consist of mood changes and changes in urine amounts. Tenofovir is a nucleotide analog reverse transcriptase inhibitor, which inhibits reverse transcriptase, an enzyme crucial to viral production in HIV-infected people. The drug therefore blocks the ability of the virus to multiply and infect new liver cells. TDF undergoes hydrolysis for conversion to tenofovir and subsequent phosphorylation by cellular enzymes to form tenofovir diphosphate. Tenofovir diphosphate inhibits the activity of HIV-1 reverse transcriptase by competing with the natural substrate deoxyadenosine 5' triphosphate. It is an analogue of the naturally occurring deoxynucleotides needed to synthesize viral DNA, but differs as it lacks a hydroxyl group on the deoxyribose moiety. As a result, phosphodiester bonds cannot be formed during DNA synthesis, leading to termination. The fact that tenofovir diphosphate is a weak inhibitor of mammalian DNA polymerase alpha, beta, and mitochondrial DNA polymerase gamma explains its higher efficacy in targeting HIV specifically. A study conducted by Marceline and colleagues compared the safety and efficacy of TDF and adafovir dipivoxil, another commonly used drug to treat Hep B. They found that among patients with chronic hepatitis B, TDF at a daily dose of 300 mg had a superior antiviral effect with a similar safety profile as compared with adafovir dipivoxil at a daily dose of 10 mg. Viral suppression was significantly higher in hepatitis B-E antigen-positive patients receiving TDF than patients receiving adafovir dipivoxil. This is shown in Figure 3 by 76% suppression versus 13%. Another study by Park and colleagues compared efficacy of tenofovir given with lamivudine versus tenofovir monotherapy in patients with lamivudine-resistant chronic hepatitis B. They found that tenofovir alone was just as effective in suppressing HBV DNA levels as it is when given with lamivudine. This suggested that tenofovir add-on therapy with lamivudine is unnecessary. This is further reinforced in Figure 4 as cumulative virulence response rate did not differ significantly between the monotherapy and combined therapy. Rennet and colleagues found TDF to be effective and safe for the treatment of chronic hepatitis B and could be considered a preferable first-line therapy. In comparison, a study by CEO in 2017 found that the use of the monotherapy of tenofovir causes transient increases in serum aminotransferases, either while the patient undergoes therapy or after. A study analysing the effect of breastfeeding in mothers with HBV found that the nucleotide therapy in the third trimester with tenofovir is beneficial in preventing perinatal transmission.